Let's go over key cardiovascular drug classes, exam style. First, we have got ACE inhibitors like lisinopril. It's used for high blood pressure, heart failure, and post-MI. Next, ARBs, angiotensin receptor blockers like losartan, great for diabetic and hypertension. Beta blockers, selective ones like metoprolol, slow the heart, and non-selective ones like propranolol help in portal hypertension. Then we have got calcium channel blockers like amlodipine for angina and arrhythmias, thiazide diuretics like hydrochlorothiazide is first-line hypertension, loop diuretics like furosemide are for heart failure and fluid overload, aldosterone antagonists like spironolactone help in heart failure and potassium retention, and finally nitrates like nitroglycerin. Lisinopril. Let's master lisinopril in 45 seconds. It's a must-know for licensing exams. It's an ACE inhibitor ending in pril. Mnemonic is Texas ACE Love Prils. It's easy to remember. It's used in high blood pressure, heart failure, post-heart attack, and diabetic kidney protection. Side effects: think dry cough, high potassium, and elevated creatinine. Licensing red flags: angioedema, rare but life-threatening, and acute renal failure, especially with kidney problems. Never use it in pregnancy. It's a major teratogen. Key interaction: avoid potassium supplements or NSAIDs. Let's cover losartan in just 35 seconds. A licensing must know. It is an ARB, angiotensin receptor blocker, ending in sartan. Mnemonic is ARBY. Sartan defends against high BP. RB sartan defends against high BP. Used for hypertension, heart failure, and diabetic nephropathy. Common side effects are dizziness, hypotension, and increased creatinine. Licensing red flags: angioedema and acute renal failure. Never give in pregnancy. Absolute contraindication. Avoid combining with NSAID or potassium supplements. Both can reduce efficacy or worsen its side effects. Save this card for smart drug reviews. Here's a quick flashcard on valsartan, a must-know ARB. It's used for high blood pressure, heart failure, and diabetic nephropathy. Mnemonic: RB sartan defends against BP. It blocks angiotensin II, stopping vasoconstriction and lowering BP. Common side effects: dizziness, high potassium, and raised creatinine. Exam alert: angioedema and acute renal failure. Watch for these. Absolutely avoid in pregnancy, major teratogenic risk. Also avoid NSAIDs, which reduce its effect and worsen kidney function. Save this short and follow for more smart drug flashcards. Thank you. Let's break down metoprolol in your pharmacy licensing prep or nursing licensing prep exam. It's a beta 1 selective blocker and used for high blood pressure, heart failure, angina, arrhythmias, and a heart attack. Mnemonic is METOP. Targets the heart on top. Beta 1 is equal to 1 heart. Common side effects are fatigue, dizziness, and bradycardia. Licensing hotspots are: it can cause bronchospasm, mask hypoglycemia, and worsen CHF if not titrated. Don't use it in bradycardia, heart block, or cardiogenic shock. Watch out for interactions with insulin and calcium channel blockers. Follow for more drug flashcard, short, smart, and exam ready. Let's start with carvedilol. It's from beta blocker, alpha 1 blocker. It's a non-selective, so it will block beta 1, beta 2, and alpha 1 receptors. Mechanism of action is they block these receptors and decrease heart rate, contractility, and peripheral resistance. It is used for hypertension, heart failure, post-MI. Side effects: dizziness, fatigue, bradycardia, hypotension. Contraindications: severe bradycardia may occur, cardiogenic shock, or decompensated heart failure. Nursing condition: you have to monitor BP and heart rate before giving and taper slowly. Patient education: you should educate the patient about changing position slowly and take it with food. Now let's start with propranolol. Its brand name is Inderal. It is a non-selective beta blocker, so it will block beta 1 and beta 2 and decreasing heart rate and contractility. It is indicated for asthma, migraine, sinus bradycardia. Its side effects include fatigue, cold hands, dizziness, and bradycardia. Here it's a typing error. Contraindicated. You should monitor blood BP and heart rate patients. Always check out for the nursing condition, and you have to educate your patient to taper down slowly and monitor their blood pressure and pulse. Today's spotlight is on diltiazem, a calcium channel blocker used to manage hypertension, angina, and certain arrhythmias. It works by relaxing blood vessels and slowing the heart rate, which helps reduce blood pressure and improve blood flow to the heart. Common brand names are Cardiovascular and Diuretics. Key side effects: you have to watch for bradycardia, edema, and dizziness. Caution: avoid in patients with severe heart block or heart failure. Always monitor blood pressure, heart rate regularly during therapy. That's diltiazem, powerful control and smooth rhythm. Are you a medical, nursing, or pharmacy student struggling with drug names, side effects, and uses? Too many details, too little time. And beta blockers, calcium channel blockers, complicated? Not anymore. Today's drug spotlight: amlodipine. Amlodipine is a calcium channel blocker used to lower BP and prevent chest pain or angina. It works by relaxing blood vessels, making it easier for your heart to pump blood. Used in conditions like hypertension and coronary artery disease. Watch out for side effects like swelling in the ankles, dizziness, or flushing. Don't stop taking it suddenly. Always follow your doctor's advice. Taken once daily with or without food. Quick tip: remember, A for amlodipine, A for arteries. It relaxes your arteries. Stay tuned for more drug flashcards. Follow to learn, revise, and pass your exams with confidence. Let's talk about verapamil, a calcium channel blocker mainly used for hypertension, angina, and certain heart rhythm disorders. How does it work? It slows down calcium entry into the heart and blood vessels. It helps reduce heart rate and relax blood vessels, lowering the blood pressure and easing chest pain. Common side effects include constipation, dizziness, and low BP. Avoid in heart failure and AV block patients unless directed by your doctor. Important tip is take it at the same time daily and don't stop suddenly without medical advice. Verapamil is equal to control plus care for your heart. Perfect for nursing, pharmacy, and medical students preparing for exams. Furosemide, commonly known by the brand name Lasix, is a potent loop diuretic. It's used to treat conditions like edema due to heart failure, liver disease, or kidney disorders, and also for hypertension. It works by inhibiting the sodium potassium chloride co-transporter in the thick ascending loop of Henle, promoting rapid diuresis. You have to watch for key side effects that are dehydration, low potassium, low sodium, and ototoxicity, especially at high doses. Always monitor electrolytes and renal function closely. Tip for exams: furosemide acts within 1 hour orally but much faster when given IV, within 5 minutes. This drug is a staple in emergency settings and on your licensing exams. Let's talk about bumetanide, a powerful loop diuretic used to treat fluid retention and high blood pressure. It works by inhibiting sodium and chloride reabsorption in the thick ascending limb of the loop of Henle, promoting rapid diuresis. Commonly used in cases of heart failure, liver cirrhosis, and kidney disorders. Bumetanide is more potent than furosemide, with about 1 mg of bumetanide equaling 40 mg of furosemide. Watch for side effects like dehydration, low potassium, dizziness, and ototoxicity. And remember, monitor electrolytes and renal function regularly. Eplerenone is a selective aldosterone receptor antagonist primarily used to treat hypertension and heart failure post-MI. It works by blocking aldosterone, promoting sodium excretion and potassium retention, reducing BP and cardiac workload. Common side effects include hyperkalemia, dizziness, and increased creatinine. It's contraindicated in patients with severe renal impairment or high serum potassium levels. Monitoring electrolytes and kidney function is essential. It's often preferred over spironolactone in males due to fewer antiandrogenic effects. It's pregnancy category B, and this was a quick guide to eplerenone. Let's talk about spironolactone, a potassium-sparing diuretic and aldosterone antagonist. It's mainly used to treat heart failure, hypertension, edema, and hyperaldosteronism. It works by blocking aldosterone, helping the body remove excess sodium and water while retaining potassium. Key side effects: watch out for hyperkalemia, gynecomastia, and menstrual irregularities. Always monitor electrolytes and renal function. Spironolactone small pill, big impact on fluid balance and heart health. Nitroglycerin is a nitrate vasodilator used primarily for the prevention and treatment of angina pectoris. It works by relaxing vascular smooth muscles, causing vasodilation that decreases myocardial oxygen demand. It is commonly administered sublingually for rapid relief or as a patch or tablet for long-term prevention. Side effects include headache, dizziness, hypotension, and reflex tachycardia. Caution is advised in patients taking phosphodiesterase 5 inhibitors due to the risk of severe hypotension. Nitroglycerin requires proper storage in airtight containers away from light and moisture to maintain its potency.